drbean.com. Today we'll continue with our discussion about iodine. So iodine has been a topic that we've been waiting for some time. So let's start our discussion. Let us start discussing this topic. I'm going to share my screen and we'll start. So first of all, once again, a reminder, this is drbean.com and all the COVID-19 discussions are there. For example, today they had actually removed the Comstat mesylate, which I was quite heartbroken about because Comstat mesylate was a lot of love that I had put in creating content for that. So they removed it. I made an appeal and they have reinstated that. So that is a good news, but we still have a vitamin D study not there, remdesivir not there, and some ivermectin not there. So I'm putting in the appeals. Hopefully that would work. Thank you very much for your support in the meantime. I am also putting these videos on BitChute. What I'm doing is that the new videos as I am recording, we are putting them on BitChute right away, and then we'll catch up with the previous videos. So with this, thank you very much for joining. We are talking about the iodine. So let's look at iodine here quickly, and then we're going to go and look at some studies as well. So look, iodine it is found in elemental state, that is as an element, or it is found in an ionic state as well. So if you see here, this one is the elemental state, atomic number 53. Then it can be in the ionic form as well, for example, iodide, or here, iodate. So that is IO -3. So iodate is, so I drew it as it is on a date. So iodate. Then the iodine can also be combined with organic compounds. So here we have carbon, which is a central part in the organic systems, and it has iodines attached to it as well. So these are organoiodines. And one more iodine that is interesting for our discussion today, and that is iodines that are combined with carrier proteins or carrier compounds that can take the iodine and then have free iodine in them and kind of distribute them in the body. So these carrier compounds are called iodophores. For example, povidone iodine here, what I've made is that there's a carrier, this car is a carrier, and in there is the iodine, free iodine present. And when this is injected into our body, then that, or administered or eaten, then it is going to be releasing iodine. So that is the iodine itself. Let's look at one study here, which is very interesting. Iodine is one of the compounds that are very good antiseptics and or disinfectants. The terms can be interchangeably used, but normally antiseptic is used. The term antiseptic is used when we apply something that can be biocidal. Biocidal means something that can kill pathogens or microorganisms. So if we apply a biocidal on our skin, then we call it an antiseptic. But if we apply the biocidal on a surface, not living surface, but tables and other things on a surface, then we call it a disinfectant. So iodine can actually act as an antiseptic or a disinfectant both. So here, if you look at this, they're talking about, so this is a very decent study here. They have all kinds of antiseptics and disinfectants that they have discussed here, including alcohols and aldehydes and so on. In this, iodine is here as well. And this is what is interesting. The antimicrobial action of iodine is rapid, even at low concentrations, but the exact mode of action is unknown. So we don't exactly know how does it break the pathogens, but it does very rapidly at a very low concentration. This is why iodine is used for superficial wounds to clean them and to clean the, in the surgical settings, to clean your hands or wash your hands and to wash the area of the skin where the surgery will be done. So iodine is very commonly used there. Iodine rapidly penetrates into the microorganism and attacks key groups of proteins, in particular the free sulfur amino acids cysteine and methionine, nucleotides and fatty acids, which culminate in cell death. Less is known about the antiviral action of iodine, but non-lipid viruses, parvoviruses, are less sensitive than lipid viruses. And luckily, the coronavirus is a lipid virus. Similarly to bacteria, it is likely that iodine attacks the surface protein of enveloped viruses. Remember, coronavirus is an enveloped virus, but they may also destabilize membrane fatty acids by reacting with unsaturated carbon bonds. So this is the study here, and let's look at it very quickly. So here, uses in medicine. So over here, you as a disinfectant or as an antiseptic. So when applied on the skin, it would be antiseptic. When applied on a surface, it will be a disinfectant. So here you can see that iodine is breaking the coronavirus's cell membrane, or I shouldn't call it a cell membrane, the envelope membrane, and it kind of breaks it down, and that causes the virus to not be viable. Similarly, over here in this diagram, you can see that iodine, this is a bacteria, the red one, and iodine is in it. And what it does is that it attacks the cysteine, methionine, which are amino acids, nucleotides, which would make the RNA or DNA for the pathogen, and then fatty acids in the pathogen. So when these things are attacked, the pathogen is killed. So once again, antiseptic, antibacterial, or disinfectant. Continuing on, there is the, let me see, okay, cool. And then, of course, the most important part is the thyroid gland. So let's look at that for a second here. Look, thyroid gland uses iodine, and we'll talk about that in a second, that how does the thyroid hormone is formed and what is the role of iodine in there. But for the time being, if we just agree on one thing, and that is thyroid gland uses iodine to make thyroid hormones, and for that, sometimes if we want to protect the thyroid gland, for example, in which cases, so if you see here, number one is the case when we are going to give here, if we are going to administer radioactive iodine to either scan for some neural tumors or to treat those tumors, we are trying to make sure that iodine, that radioactive iodine, does not end up in thyroid gland and does not cause damage there. We want the radioactive iodine to go and cause damage to the tumor in the brain, but not to the thyroid. And remember that thyroid picks up about 30% of the iodine that is available. 70% of the remaining iodine is in the other body tissues. So because a large quantity of iodine will be picked up by thyroid, if the iodine is radioactive, then it's going to go be picked up by the thyroid and cause damage to the thyroid gland. So such a substance is iodobiguane, and that when it is administered, it would be causing damage to the thyroid. So what do? Is we take a special form of iodine, which is called potassium iodide. So here we have a potassium which is combined with an iodine. So these two are administered in the thyroid hormone or thyroid gland. So what we do is, before administering radioactive iodine, one day before that, we give potassium iodide. The thyroid hormone is going to the thyroid tissue is going to pick up the thyroid potassium iodide, and now potassium iodide is sitting in the thyroid gland and would not let more iodine come in. Then when we give radioactive iodine, that will not go to the thyroid gland, or a very tiny amount will go to the thyroid gland, because thyroid gland already has potassium iodide in it. And so this potassium iodide is usually given one day before the radioactive iodine is given, and then it is continued till one day after the radioactive iodine test or administration is done. So that is one. So if you see here, in this thyroid gland, we have the potassium iodide already given, and what it has done is it has closed the doors towards the iodine entry. And now if we give radioactive iodine, that will not be able to go into the thyroid gland and cause the damage. Similarly, if you see here, in case of a nuclear bomb, when the radiation is produced, a large part in that radiation has ionized iodine, and that is called iodine 131. and there is a very large quantity of that. If that iodine is taken up by the thyroid gland, then that radioactive iodine, if you can see here, it is looking very scary. That radioactive iodine is going to go and cause the tissue damage. So this can happen during a nuclear bomb. This can happen during a nuclear accident. This can happen to the people who are working in the nuclear facilities. So to protect from that, once again, potassium iodide is given to kind of fill the thyroid gland with the potassium iodide, and no more or very tiny amount of radioactive iodine can then enter the gland and damage it. So that is another protection. Thirdly, in the acute thyrotoxicosis, so that is a situation where thyroid hormone or thyroid gland is picking up iodine in an acute state, and there is a thyrotoxicosis, or there is a large quantity of thyroid hormone being made. So in such situation, we want the thyroid hormone to stop taking iodine and to stop making more thyroid hormone. I'm talking about thyroid tissue. We want the thyroid tissue not to make too much of the thyroid hormone. So what we do is we fill the thyroid tissue once again with potassium iodide, which will then cause reduction in uptake of more normal iodine, and that would reduce the production of thyroid hormone. So these are the three cases where we can protect thyroid gland and we can combat thyrotoxicosis by giving potassium iodide. Continuing, so here is the quick discussion of how the thyroid hormone itself work and how does iodine play a role in there. So it is a very interesting one. So look, this is our pituitary gland. It is present in our brain, and it is present near hypothalamus, near the what is that called, optic nerve chiasm. But anyways, for us, generally present in the brain. The pituitary gland has three parts. One is the posterior lobe, or which is called neurohypophysis. Then there is an anterior lobe, or adenohypophysis. This is a glandular part. And then there is a central part here as well, which is called pars intermedia. The anterior part, this green part over here, it releases a hormone or a substance called thyroid stimulating hormone. And this is released. Can you see its hands? It has large hands because it's going to go and tickle the thyroid hormone and kind of make it release. So I keep calling it thyroid hormone. It is a thyroid gland. So thyroid stimulating hormone will go and tickle the thyroid gland so that the thyroid gland in turn will release T3 and T4, which are thyroid hormones. So TSH is released from the anterior part of the pituitary. Once the TSH is released, the thyroid stimulating hormone is released, that hormone would affect onto the cells of the thyroid. And the thyroid structure is such that if I make it over here, let's say here is the thyroid gland. In the thyroid gland, there are lots of circular things or rounded packets. We call them thyroid follicles. The thyroid follicles in turn are made up of, imagine they are balls, which the wall of the ball is made up of cells, and the center of the ball is all fluids. So if I cut one of these and show it here, what would happen is it is going to be something like this. So this is like a half ball cut down, and the wall is made up of cells. So these are the cells. And then the central part here, this green part I'm going to show here, this is the central lumen in which there is colloid or thyroid colloid present, or some fluids are present here. Now what happens is that from the blood vessels, our body will pick up iodine, which is usually in the negative form. So iodide, an anion, it takes the iodide plus it takes sodium. Both of them through the cell are then brought in to the colloid. So that is the structure I'm making here. So let's look at it. So imagine that this is a blood vessel. Inside the blood vessel, we have iodides. Iodides are the anion form of iodines. In the cell, this is a cell of the follicle or a thyroid cell. In the cell, there is a channel that is called symporter. It is a sodium iodine symporter. Symporter means that something that would move two things together in one direction. So what it would do is this channel would allow the iodine to move into the cell, plus we would have sodium come in as well. One question that is still not clear to the scientists is how does iodine move through the endothelial cell of the blood vessel then to reach near this importer? That part of the mechanism is not clear. So once the iodine is inside the cell, then what happens is, or the iodide is inside the cell, the ionic form, then what happens is from the cell, it is once again through a channel moved into this central space that inside of the ball. Over there, we have an enzyme called thyroperoxidase. Thyroperoxidase that would oxidize this iodine here. So this iodine, which was negatively charged, it will be oxidized by this enzyme, and that would create a neutral iodine, or you can call it almost elemental iodine. This iodine is now going to be useful here. So just keep this in mind that we have iodine that has reached the center of the ball in the colloid space where the fluids are. Now, on the other hand, if we go back to this cell here, this cell, in this cell, we also have another protein formed, which is called thyroglobulin. Thyroglobulin protein, if you can see, it is made inside packets. So the cell has small vesicles in them. Those vesicles have thyroglobulin protein in them. And if you look at the structure of this protein, you would see that there are lots of these compounds attached here or molecules attached here. This protein, thyroglobulin, is also released into this space. So imagine that the surface of the wall of the ball is made up of cells. Inside the cells, we are making thyroglobulin, a protein, and then we throw that protein in the center of the ball as well, which is filled with fluids. So now we have this protein over here, and we have iodine over here. Then what we do is we do a process that is called iodination. What does that mean? We have an enzyme over here. That enzyme will pick up iodine in the process of iodination, and it would combine that here. So do you see these blue things, eyes attached? So it would connect the iodines to these molecules. So if to these guys, let me just draw that separately. If we have, let's say this is a molecule here of thyroxine, and if we have 1 and 2 iodine and then one more near it, which has also 2 iodines attached to it, then this will be total 4 iodines, and this will be tetra iodine, or we call it thyroxine, or tetraiodothyroxine. On the other hand, it is also possible that sometimes on one molecule we have 2 iodines attached, and the other molecule has 1 iodine attached, and this together is called triiodothyroxine. So this whole thing is called a thyroxine, and it has 3 iodines attached to it, so triiodothyroxine. So that is the T3. And if there were 4 iodines attached, then that will be a T4. So how does that form, the T3 and T4? So if we go back here, once we have the iodination of this thyroglobulin, that iodinated form of thyroglobulin is then pumped back into the cell. So from the cell, iodine and the thyroglobulin were brought into the space. Over there, iodine or iodide was converted into iodine, then it was combined with thyroglobulin. That combined stuff was then sent back into the cell. Once it is back into the cell, if you can see here, the thyroglobulin is broken up into smaller pieces. the protein itself, and then these portions are separated from it. If you see here, this is 1, 2, and 3 iodines attached. So this is a T3. And then here 1, 2, 3, and 4 iodines are attached. So this molecule is a T4. These T3 and T4 molecules are then in turn once again released back into the blood. So there is one more question here, and that question is, how do these molecules go back into the blood? So let's say if we have a blood vessel here, let's say there's a blood vessel nearby, how do these things go into the blood? So far, we have been studying that it is probably osmosis or diffusion. So the T3 and T4 diffuse out of the thyroid follicular cell and then go into the blood vessel. Although the latest studies show that there is a channel that is specialized to move the T3 and T4 out of the thyroid gland into the blood. The eventual outcome is that iodine or the thyroxine, the T3 and T4, are brought back into the blood. So let's say now here we have another cell. This is a target cell where thyroid hormone would work. And before we go there, just a quick thing here. In our blood, T3 and T4 ratio is that T4 is about 14 times more than T3. About from 14 to 21 times more than the T3. However, in our body, the T3 is the active form of the hormone. So when our cells are going to use the thyroid hormone, they are first going to change T4 into T3 and then they are going to use it. So in terms of activity, in terms of potency, T3 is actually much more potent, I think 20 times more potent than T4. However, T3's quantity is 14 times less than T4 in the blood. So with that, so imagine that this is the T3 and T4. These guys have now arrived in a cell. What we do is that we, inside the cells, we have an enzyme called iodothyronine deoxidase. So what would happen is that it would take the iodines attached to T4. It would take one iodine and remove it. That would make a T4 into a T3. So inside the cell, before we can use the thyroid hormone, normally we convert T4 to T3. Then T3 is the one that is further deaminated and then used, or actually deiodinated and then used, meaning we keep taking more iodines away from it and it does its function. So this is the normal mechanism of how thyroid hormones are produced and how the iodine is used. So iodide is brought in, converted into iodine, combined with the thyroglobulin, from where we make T4 and T3, bring them out in the blood. From the blood, T4 and T3 go into a cell. We convert T4 into T3, so everything is T3, and then we continue to remove iodine from that hormone, and it does its function. Now, finally, the last part of the discussion today is a couple of diseases that where iodine is used as a management, as a medication. So one disease is here called Graves' disease. In the Graves' disease, what happens is that this is a thyroid hormone, and imagine that the cells of the thyroid gland, I keep calling the gland a thyroid hormone, so my apologies. This is the thyroid gland. This is the thyroid gland. So imagine that this is a cell of the thyroid, and that cell has a thyroid stimulating hormone receptor on it. What does that mean? Remember that green receptor, green hormone that was going to go and tickle the thyroid cells? So this is a receptor here for the TSH hormone. When that hormone comes in and tickles this receptor, that would then cause the cell to make more T3 and T4. However, in some people, what happens is there is an antibody produced by their body. So this is an autoimmune disease. They make an antibody that goes and attaches to that TSH receptor and just continuously keeps on activating it or keeps on tickling it. So now we do not need TSH to come and do anything. We already have now an antibody incorrectly produced by our immune system. So it is an autoimmune disease, and that antibody is continuously stimulating thyroid stimulating hormone receptor. The result of that will be what? Thyroid gland would continue to produce a lots and lots of T3 and T4. And the result of that is that when our body's tissue work a lot, they become bigger. Just like if you do weight training and you make your muscles work a lot, the muscles will become big. Similarly, when thyroid is now working a lot, it would become big. So thyroid gland will become big. So like goiter. So diffusely, the thyroid gland would become big, and you can actually see it on the front of the eye. And of course, not only the gland is big, it is making a lot of T3 and T4. So how do we now take care of this gland? There are two ways. One is that by using surgery, we can take a part of gland away. Or the second is that we can give radioactive iodine. Radioactive iodine will be taken up by the thyroid gland, and it would go and damage the thyroid cells. And that would cause the thyroid to become shrunken again and go back to normal state. So this is the use of the radioactive iodine, I-131, to give to the thyroid, which is working more than normal because of an autoimmune continuous stimulation of it, and that is the Graves' disease. The other disease is Hashimoto's thyroiditis. So what happens in here is the similar thing, that we have thyroid stimulating hormone here. We have thyroid stimulating hormone receptor here, and I'm just as an illustration making it on the outside of it. Normally these receptors, so if this was the follicle of the thyroid and these were the cells, the receptors are present on the cells, and thyroid stimulating hormone is going to come and attach there and activate them. However, so if we go back here, this is the thyroid stimulating hormone receptor here, this blue one, and this is another antibody. So this is also an autoimmune disease where our immune system has made an antibody, but this antibody, instead of stimulating the receptor, it is actually blocking the receptor. So now the receptor cannot respond or cannot bind with TSH. And the receptor, when it is not bound because it is occupied by this antibody, the thyroid will not function because thyroid would think that nobody is tickling it. There is no action. There is no message to work. So there is a comment on YouTube, sir, you don't get tired? And no, I think these are exceptional times. We are all in a state where we all have to work harder than what we can do. So we all have to do this. But thank you very much for your concern and question. Back here, so the antibody is now occupying the thyroid stimulating hormone receptor and not letting it be activated. What would be the result of that? Now the thyroid hormone is working less than normal. So now the patient is going to go in hypothyroidism. Here, patient had gone into hyperthyroidism. That was a grave situation. That was a bad situation. So that is why it is called Graves' disease, just to remember it. And here, thyroid gland has gone into hypoactivity because the receptor is not stimulated. The other possibilities for Hashimoto are that antibodies not only for the TSH receptor, there can be antibody for thyroid peroxidase. Thyroid peroxidase, we saw that up here, that we have this enzyme. Remember this enzyme, thyroid peroxidase? This enzyme here, what it does is it takes iodide and converts it to iodine. So if this enzyme is not functioning properly, then the thyroid hormone will not be formed, even when there is TSH available, even when there is iodine available, even when there is thyroglobulin available. Even then, the system would not function because an important enzyme is missing. And how is this enzyme missing? Let's say this is that enzyme, thyroperoxidase. There is an antibody that is going to come and attach and bind with it and make it useless for its function. So again, an autoimmune issue. So the end result is that we are not forming elemental iodine inside the the follicle of the thyroid gland. And when we do not have that, we cannot make T3 and T4 anymore. So that is another reason which would give rise to Hashimoto's thyroiditis, or a thyroid gland that has this inflammation plus is working less. A third way of Hashimoto's is that there is immunoglobulin against this protein, thyroglobulin. So if there is an antibody that is made that gets combined with this thyroglobulin, then this thyroglobulin cannot function correctly. We cannot use it to make T3 and T4 from it. And once again, we would have every element will be present. Iodide will be present, iodine will be present, the thyroglobulin is present, but now thyroglobulin cannot combine with iodine. We cannot make T3 and T4, and so the patient is going to go in hypothyroidism, and there will be inflammation because there are antibodies there, and that is why it is thyroiditis. So in this situation, once again, if you go back here, in Hashimoto's thyroiditis, there can be antibodies against the TSH receptor or against the thyroglobulin or against the thyroid peroxidase. In all of these cases, now we need to give thyroid hormone from outside. And so if you see here, here is the thyroid hormone very proudly standing there. So of course, iodine is used to build that hormone. This is a T4, it is levothyroxine. It is a T4 substance that is given to the patient, and then it converts into T3 and work. One can also give active T3 as well. So that is the discussion for the iodine today. Hope you enjoyed it. So once again, at the end, please like, share, and subscribe. YouTube keeps trying to take the videos down. We keep trying to keep them up. I have started putting the videos up on BitChute as well. So please, your help, that like, share, and subscribe. And what would you like to discuss tomorrow? So I think our Math Plus protocol is done. We have not discussed from the Math Plus, we have not discussed the norepinephrine or vasoconstrictors. We have also not discussed one more thing, statins. We have not discussed statins. Will you like to discuss statins or norepinephrine tomorrow, or would you like some other topic? Let me know. Thank you very much for your time. Please like, subscribe, and share, and see you tomorrow.